IVF is being seen as the first resort these days. If anyone wants to go for their egg freezing or sperm freezing before they hit their, say, mid-30s, so this is the best option these days. You will have to go through financial stress, you will have to go through economic stress, you will have to go through a mental stress. So in case you are prepared, then only you start the IVF. Pollution is on the rise and lot of adulteration in the food, lot of pesticides we are having these days, which also leads to infertility. Anyone who is above 30 years of age and have been trying for say 12 months to 1 year should consult a fertility specialist. These days, because of stress and smoking, the male infertility is on the rise. As much as I would say 50 to 60% of the cases, the male is the responsible factor.
Ready to rethink everything you know about IVF? Let's break some myths, reveal some truths about IVF right now. I have with me IVF specialist Dr. Shalini Jain Nawal. Thank you so much, doctor, for being with us today.
Thank you so much for having me here.
It's a pleasure. So the first question that a lot of people wanted to know, that is IVF the last resort, or are there some cases in which it could be the first option that a couple takes?
Surprisingly, things are really changing in today's scenario. Since you're having DINGs, which is the double income, no kids couples these days, and the couples want to get married late as well. So IVF is being seen as the first resort these days. If anyone wants to go for their egg freezing or sperm freezing before they hit their, say, mid-30s, so this is the best option these days. So they can get their eggs frozen, their sperms frozen, and then they can decide upon when to have kids later on in their lives.
And it's easy in terms of like other things like your body at 40 and all that doesn't have an effect, but so this is like the safe option to take.
Likewise, I told you, we should start early. The best age is before 28 years of age. If you want to freeze your eggs or you want to have children. In case you want to have children later on in your life, so you should start early and just freeze your eggs, which is very safe because we give hormones these days to stimulate the eggs, which are very safe, and it is quite a safe procedure.
So, you know, for a lot of couples, IVF is also a very emotional journey, right?
True.
I think a lot of them come to you after they've sort of tried everything else. How do you deal with that? We'll get to the physical aspects of it a little later as well, but that emotional journey, talk to us about that.
Whenever a couple walks into my OPD, I always tell them, you will have to go through financial stress, you will have to go through economic stress, you will have to go through a mental stress. So in case you are prepared, then only you start the IVF. I always ask them how eagerly they want the child, and then likewise they should start the procedure.
You spoke about financial aspect of it. Talk to us about that. Let's say a couple comes to you. What would be an average financial cost and a journey for a couple?
Yeah. So it varies from clinic to clinic. Let's talk about my clinic. So it will cost around about somewhere between 1 to 1.25 lakhs, the whole procedure. And in case you're looking at donor eggs or PGT test, which is a genetic test, then that cost will come extra.
So everyone's got to be, and how long will it take? What's the...
Normally, when a couple comes to me, we do some preliminary tests, which are the blood tests. Then we call them on day 2 of the periods. When the lady starts her periods, that's the day 1. So generally, we call them at the day 2 of the periods. We do an ultrasound to see the egg reserve. What is the egg reserve, which we call the antral follicular count or the AFC. It gives us a fair enough idea how she will respond to the IVF treatment. Then there are injections for stimulations, which normally we are giving these days subcutaneously and which are painless. Earlier there used to be intramuscular injections and they were quite painful, but now we are giving subcutaneous injections which are painless. Say we'll give the injections for 10 to 12 days. Then we will call her for egg extraction. And it is done through a transvaginal ultrasound probe, and there's a very fine needle which can aspirate the eggs, and then we take out the eggs from the lady, and then we have the sperms from the husband. We fuse the eggs and the sperms make embryos. So this process takes around about 10 to 14 days.
And then it's inserted back into...
Yeah, so normally we are doing the freeze all principle these days. We freeze the embryos, call the lady on the next cycle, build up our endometrium, and then we implant or transfer the embryos on the again 14th to 21st day of the cycle.
Right. So, you know, you've obviously identified the periods which are the best for sort of, you know, getting the eggs and transplanting them, fusing, all of that. But tell me, does a person's lifestyle, let's say stress or sleep or diet, can that affect?
Definitely. Stress is the number one culprit. So if you are coming for IVF, you should be stress free. You just forget about the results. You just forget about the financial aspects, and you have to be stress free. The best thing is do exercise and do meditation. Yoga really helps. Yoga does help. So and secondly, then lifestyle. You've seen alcohol consumption is on the rise, smoking is on the rise, and more so in women these days. So it adversely affects the women's reproductive system.
Right.
For sure.
Also, you spoke about freezing the eggs, and I thought that was interesting. What would be the best time period for a woman to freeze her eggs? Like, what would that age
The
be?
ideal age is 25 to 28 years.
Oh,
Yeah.
as early as that?
As early as that. But yes, if you decide later on, okay, I'm not going to have babies right now, just let me freeze my eggs. So up to 32 years of age also, you may come.
What happens after 32?
Yeah, so as we age, the egg quality or the egg reserve comes down. So if say a 28-year-old is coming to me, I may be able to extract 15 to 20 eggs from her. And if the same lady is coming to me at 32 years of age, so maybe I'll be able to extract only 8 to 10 eggs. And if she's 40 and above, maybe just 2 to 3 eggs I'll get.
Wow. But have there been success stories in 40 and above women as well?
Yeah. The oldest age I did IVF was 55 years. But
Wow.
that was before the ART Act came into being.
Okay.
Because the ART Act now restricts the age of women from 21 to 50 years. And for males, it is 21 to 55 years of age.
55, that's
Yeah.
quite something. That's like the most unexpected pregnancy. But you know, again, you said about males, and that's very interesting because every time that somebody thinks of IVF, they think, oh, the woman, you know, the woman can't have babies, or there's something wrong with the woman. Speak to us about the male aspect of it, and when is it that, you know, men, you know, who are having problems, and what is that about?
So there always has been the social stigma attached to the women if you're not able to bear a child. But surprisingly, males are equally responsible. And these days, because of stress and smoking, the male infertility is on the rise. As much as I would say 50 to 60% of the cases, the male is the responsible factor.
Right. But in terms of, is it the sperm quality? Is it the lack of sperm? What is it?
Both. Lack of sperms also we are seeing, which can be because of smoking, because of stress, because of certain infections. And the infections lead to blockage of the epididymis, which are the tubes from the testicles to the ejaculation site. So all these things lead to nil sperm count. And poor sperm quality, again, the same factors are responsible.
And so that's the time you have to get them in. And tell me, is there, apart from actually just taking the egg and the sperm, is there some, do you also advise on ways they can increase their sperm count and sort of, you know, is there that science also behind it?
To increase the sperm count, diet is very important, and certain antioxidants we prescribe to the patients, which is important. We have to rule out other infections also in the patients.
Right.
And smoking is a complete no-no.
Okay. You know, there's a lot of talk about pollution nowadays and how environmental factors are affecting our health. Does that also affect fertility? And
if we are staying in Delhi, for example, so staying in Delhi means you are smoking 20-25 cigarettes a day. So that answers your question.
so it is having, even if I'm not smoking, it is having an effect
Yes,
on...
a passive way. In a passive way, definitely it is being harmful for fertility.
So, and this is the sort of, it is leading to what you see, a rise in a lot of people coming to you or young couples coming to you with infertility
Definitely,
factors.
definitely. Pollution is on the rise, and lot of adulteration in the food, lot of pesticides we are having these days, which also leads to infertility.
Right. Okay, speak to me about home fertility tests. They are sort of, on the rise, so to speak. What are they about? Are they effective? What is your view on it?
Look, home fertility tests, what happens when the lady gets her cycle? So she starts ovulating roundabout on the 10th to 12th day of her cycle. So first and foremost, there are kits available for home testing for ovulation. So you put a drop of urine on those kits and you get to know when the LH surge is there. And a lady ovulates roundabout after 36 hours of that LH surge. So then you can plan your intercourse accordingly. So when the spike is there, you will get 2 lines on the kit. So you'll get to know that, okay, I'm going to ovulate 36 hours from now.
So,
and then you can plan your intercourse accordingly. So that will definitely increase the chances of conception.
so they do work. I mean, at a very basic level, you can.
At a very basic level. Say a couple who is recently married for 6 months, 7 months and have been trying and they're not successful. So they can try, and they're less than 28 to 29 years of age. Anyone who is above 30 years of age and have been trying for say 12 months to 1 year should consult a fertility specialist.
Okay, what are the effects of IVF on a mother and a child? Is there anything people should know about?
It's completely a myth. IVF has been around for almost now 40 years and there are a lot of researches going on, the side effects on the child and on the mother, and it is completely safe.
There is nothing that will affect.
There's no side effect.
Okay. Another thing that I wanted to ask you was that what are the early warning signs? Like, for instance, you said that, if you're beyond 30 years of age, you've been trying, but are there any other signs that a couple, a man or a woman should look for to know that, okay, it's not happening, or now I need to go to a fertility expert?
Sadly, there are very few signs, like if a lady is having irregular periods, or if she has had a history of PCOD, or she's having a lot of acne on her face, or a lot of facial hair which is abnormal. So these are signs of PCOD or polycystic ovarian syndrome. Then those are the warning signs that, okay, you might have difficulty in having a child. And secondly, if you're having thyroid, or if you're having diabetes, or if you've had a past history of tuberculosis, then yes, those are also warning signs. If you are smoking, if your diet is not good, if you're not exercising, if you're overweight, so all these are danger signals.
Basically, smoking, drinking, overweight is a bad sign for everything. Okay, you've been doing this for so long. Are there any new technologies that are exciting you currently?
Yeah, definitely. So we are doing these PRPs for thin endometriums. For poor ovarian response also, we are doing PRPs. We are injecting PRPs into the ovaries and getting good egg count. And we are getting thick endometrium. So there are these new techniques which are coming up. Lately, stem cell holds a lot of promise. It holds
Speak
a
to
lot
us
of
in very
promise.
simply, what is that about? Like,
okay, stem cell will lead to in vitro gametogenesis. That means even if you're not having eggs, good quality eggs or good quality sperms, so we can take the stem cells and develop into your eggs or sperms respectively.
oh wow.
Yeah.
So what stage is that at? Because that's really revolutionary in a way.
In India, it's not come as yet, but in Australia, yes, there are a lot of researches going on.
But has a successful case?
Of course, yes.
Oh, really?
Yes.
That with stem cells, they've actually developed eggs and sperm.
Sperms,
and
in vitro, in the lab.
That's
quite
something.
promising. And in China, they have developed an artificial womb.
Right.
So you don't need a surrogates now. You don't need human surrogates. So that's an artificial womb. We can transfer your embryo into the artificial womb
And raise the baby there.
Baby for 9 months.
Wow.
Yeah. So that's going to be the next big thing.
It's just incredible in this age of AI. There is so much development. Okay. If there's a young couple watching and they're a bit fearful, they don't know what to do, they're hesitant because, you know, even now there's a little bit of a stigma attached to not being able to get pregnant. What would you say to them?
I would like to tell them that you have to change your lifestyle for sure. Don't be afraid of anything. Just burst all these myths about IVF and consult the right doctor who can help you out through the journey.
And it's possible and it's all going to be okay.
Nothing is impossible in this world.
Okay, so we're going to, before we end this, we're going to do a quick segment of, like you said, busting myths about rapid fire about IVF. So IVF is only for female infertility?
Myth.
Okay. IVF always results in twins or triplets?
Myth. 20 to 30% rise is there in having twins. In fact, one of my patients, she had 5 fetuses in her womb. And we had transferred just 2 to 3 embryos. And I don't know, inside the
what happened?
I know the embryos multiplied themselves and she resulted in 5 fetuses. Of course, we advise her to undergo fetal reduction at 10 to 12 weeks of pregnancy.
And did she or did she have 5 babies?
No. Then she went for fetal reduction and she delivered 2 twins.
Oh.
She delivered twins. And one of my patients had triplets. Though I advised her against it, but she was really adamant and she had triplets.
Okay. IVF guarantees pregnancy.
Myth. Okay. There's only 35 to 40% chances of IVF leading to successful pregnancy.
Oh, just 35 to 40?
Yes.
Wow. Okay. IVF is only for older women.
Again, a myth. If a younger woman, say 25-year-old, is not having a child, she may be having a poor ovarian reserve, she may be having a tubal blockage, her endometrium may be thin, she may be having adenomyosis in her uterus. So even a 25-year-old will require IVF. Or for example, the husband has nil sperm count, then also he will also require IVF.
Right. IVF is extremely painful or unaffordable.
Myth. It's a myth. It's a myth.
Okay. IVF babies are less healthy.
Again, a myth. Absolutely.
Okay. Last question before we finish. People who don't succeed with IVF, what do you say to them?
Try until you succeed. So I had a patient who had gotten various IVF cycles done at other places, and the 10th time she came to me, and by God's grace on the 11th IVF cycle she got a child.
11th?
Yeah.
My God, that is incredible.
Yeah.
Thank you so much for coming here today. That's it on Your Health Decoded. Do join us again next week.